My name's Amy Lansky, and I'm the Acting Director of the Office of National AIDS Policy at the White House. So I came of age at a time when AIDS was new and it was scary and people were dying, and that urgency drew me in. I'd been working in women's health, and I got my start in HIV working for a community-based organization in Chicago doing AIDS education for women. And then I moved to go to public health training in North Carolina, and I continued my work in HIV, but I also grew an interest in research and data. And so when I finished school, I went to work at the Centers for Disease Control and Prevention in Atlanta and worked there for 20 years doing HIV surveillance and research. And now that I'm at the Office of National AIDS Policy at the White House, I'm changing my role from producing the data to using the data to make policy. And what's kept me in the field of HIV prevention for all these years is really a sense of social responsibility. So HIV is not just about the virus. It's about gender inequality, it's about gay rights, it's about addiction, and it's about poverty. And that sense of wanting to make the world a better place, the way I can do that is working in HIV. And it helps to make our society and our world a better place for our children and our children's children to grow and thrive. It's important to end HIV because we can end HIV. We have the science and we know what works. We have more and more effective options than ever before. We have HIV test technologies that can detect infection within days. We have effective treatment that saves lives and reduces transmission. And we have pre-exposure prophylaxis that can prevent infections from happening. Taken together, we can move forward. We need to make the moment to make it happen to end HIV. Policy needs to be based on scientific evidence. We need to garner the political will to fully implement these prevention and treatment options. And we need to address the stigma and discrimination that impede the possible. We have the National HIV/AIDS Strategy as our roadmap, and we are implementing the strategy, and we are on our way.
For more information about the Office of National AIDS Policy, visit whitehouse.gov.